Assalamu alaikum warahmatullahi wabarakatuh. It's a pleasure to be with you today, and we'll be talking about diabetes mellitus. Diabetes mellitus, as is known in general parlance, is a disease in which you have sugar being passed in the urine. A lot of people will say, oh, it's a disease that you urine and then you urinate and then you dry up. Whatever we call it, diabetes mellitus is caused by a deficiency in a substance that is supposed to deal with sugars, with carbohydrates that we take in, and then convert this into what we can use in the body. There's a deficiency of this substance which is called insulin, and once this is deficient, the individual may eat as voraciously as you may imagine, but will not be able to utilize the end product of the food. Therefore, his appetite is there, he's always eating, but he's losing weight. Again, because he cannot use the sugar at the end of what he's eaten, he finds himself always going to the toilet because he's always passing so much urine. He wakes up even in the night to pass the urine. Urine appears to him as foamy, and sometimes when people allow the urine to stay in the house, maybe it decides deliberately to put it somewhere that ants can get there, it comes back and say, oh, I put my urine out and ants went in there because of the sugar, of course. So he's eating so much, he's losing weight, he's urinating so much, and of course he's always thirsty and always wanting to drink something. These are the common symptoms of diabetes mellitus. I've said earlier, it's a disease of deficiency of insulin, insulin being the substance that's supposed to deal with the end products of carbohydrates to make it useful for the individual. Who can it affect? It can affect anybody, although if one has a family history, if a father or a mother had the disease, then one is more prone to having diabetes. And then what do we do? Because these days when you switch on your television, you hear all sorts of things. People will say, oh, if you take this, you'll get cured. If you take that, you'll get cured of diabetes. Diabetes mellitus is not a disease that can be cured, but it's a disease that can be properly managed. You go to the hospital, you're properly diagnosed. They will tell you if it is an insulin-dependent type of diabetes, that means the individual will be dependent on taking injections of insulin for life. And then you're also taught dietary management. What are the things that you are supposed to eat? You do not take so much carbohydrate. You take, you increase your protein intake and all this and that. You do more exercise. You do not take alcohol and all that. So you are trained on how to ensure that you manage the diabetes properly, and if one manage, you can live and live with it. But for one to be told that it has been cured and then you go home and then you forget about it, then of course the individual will come back to the hospital with all sorts of complications. The other thing that we always tell diabetic patients, apart from the fact that you need to be properly monitored, you have to take your medications, you also need to watch your food. There's so much to say about diabetes, but there's so little time at this point. But the important thing for us to note is that diabetes is not a disease that can be cured. It can only be properly managed, and the only place that for it to be properly managed for you to seek orthodox medical care. Till I come your way again, Assalamu alaikum warahmatullahi wabarakatuh.